subcommittee and provide whatever support, which it can be technical, it can be ideas, it can even be resources of any kind. So the structure is we work through technical committee, and we have 10 technical committee. I'll just mention a few. We have a committee which deals with the case management, care of the patients, for laboratory, for surveillance, for risk communication, port of entry, and research, and the others. So this is the structure. And at the Prime Minister's office also there is a structure, and it is from the village to the national level. So whatever which comes from our ministry, the permanent secretary or the minister responsible for health will take it to the Prime Minister officer for discussion, decision-making, advice, guidance, and support. So generally, because of time, this is in brief the coordination of preparedness and response of public event in the health sector. Moderator, beg to submit.
I'm still we are running out of time, and I'd like to invite Ambele Maflambo, not really for a presentation. Ambele, we are running short of time, so I'd like to request you really to give us the highlights on what the National Public Health Lab are doing in face of these emerging diseases. Thank you. Over to you.
Dear moderator, sorry, we have 5 minutes left for 20-minute session. That means we are not going to have question and answers session.
Okay, thank you. With the short time that we have, I'd like to present the role and the responsibility of National Public Health Lab on disease outbreak and investigation. The National Public Health Lab was established in 2008, formerly known as National Health Laboratory Research and Training Center. As I said, it was established in 2008, formerly known as National Laboratory Research and Training Center, and conducted surveillance of influenza, measles, rubella, and also the HIV disease. But on aspect, we are also involved in outbreak investigation and also the quality assurance program to oversee all the lab in the country. Also the on-job training, which also is part of the National Public Health Laboratory, and also evaluation of methods, new methods, and also this WHO pre-qualification center. On molecular knowledge, which is most of the outbreak of imaging and imaging disease being done on several platforms that have the automated and also semi-automated equipment for the real-time PCR and conventional PCR. And also we have the genomic sequencing section, which we have the Sanger sequencer and also the NGS, that is the next generation sequencer. But also we started to set some writing for the cancer markers, so we also provide that service in the laboratory. But as you can see, for the conventional, we're saying that we have a conventional platform and also a real-time PCR platform. And also on serology, we have like the surveillance for measles and rubella. We are doing the analysis, and also we have antibody screening, HIV bacteria with getting equipment like Pitec, which reduce the turnaround time from the testing to get to the results. Also, we perform bacteria typing, which can type in clinical or isolate referred. So the National Public Health Lab also is a referral lab, so it used to be confirmed any kind of several diseases which can be identified in other parts of the plant. And also we are supplying the control, the standards organism, the ATCC strain, and also we prepare the EQA to oversee other laboratory performance. Also, with the AMR, we are in front line for the MR, that is saying that we've installed very modern machine for bacterial typing, and which reduce the TAT from 72 hours to 24 hours. And we're able to try to find the fungi and also bacteria organism. So, this is some of the we can say, but also the other key issue we are doing at the National Public Health Lab is for the Gazette certification. So we have our section which is, with the outbreak disease and this vector disease, we need to have a safe working environment. So we have this section which certifies the safety cabinet, not only for National Public Health Lab, but for the whole country. And also we have the mobile lab. We have two mobile lab which we can deploy to the areas where the capacity or the safety of testing for the samples or for the any pathogen is difficult. Like currently we deploy one lab in Bukoba, in Kagera, that is a part of preparedness to make sure that if there is any suspect there, we don't have to ship sample directly from there to Dar es Salaam. But also we have a good laboratory sample referral system, which is operating, which was developed in 2019, and now is well. I think this will just end there.
Looking on the time, we are remaining with 5 minutes. So I would like to suggest probably can take 3 questions. And for other questions, we'll do like the way we did yesterday. Probably can just write them. For the panelists to respond. So I'd like to see if there are any questions to the panelists. Karibuni kwa maswali. Karibu.
Good morning, everyone. Thank you very much, 3 presenters. Just a small question for Dr. Kitambi. You mentioned about some documents for emergency preparedness. Are the documents available online? And if not, how easy are they accessible to the users? Thank you.
Okay, I'm not seeing any other hand. I think maybe it was something to say like that. Okay, Dr. Kitambi.
Thank you, Moderator. We normally put all the documents in the Ministry of Health website, but recently there was a work to improve our website. So some of the documents are not there currently, but generally it's policy, or we are all required to make sure all the documents are at the Ministry of Health website. And all these documents used to be there. For the Prime Minister's office documents, if you go to the Prime Minister's office, all the documents are there as well. Thank you.
Okay, maybe for the sake of those ones actually who were not here from the beginning, we had a first presentation on surveillance, and the main issues that were presented were the current strategies that we are using just for contact tracing, and this was presented by Dr. Vida. So the areas that she touched was on the events-based surveillance, and in her presentation she highlighted that they managed to make use of that kind of surveillance to contain the COVID-19 pandemic, which is still ongoing. And they're currently using the same system actually to track any threats for the Ebola virus disease. And the second presentation was shared by Dr. Kitambi, and she highlighted the coordination structures that are being established, and she presented that we have 3 tiers. The first one is led by the Chief Secretary, the Prime Minister, then the second one by the Chief Secretary, and the third one by the Permanent Secretary, Minister of Health. And these coordination structures are pulling together all the sectors, but also we have stakeholders like the non-state actors and the development partners. But she also highlighted the policy documents, strategic documents, and also the policy guidelines that guide the coordination. And the last presenter was Ambele, and Ambele's presentation had focused mainly on what the National Public Health Laboratory is doing. So in a nutshell, that was the representation of the key pillars for managing the emerging and re-emerging public health events of international concern. So with these few remarks, we would really like to adjourn this session, and we will make use, I've seen there is a hand. Karibu. Muda wetu hapo umeisha dakika 15 zilizopita. Kwa hiyo tunaomba uongee kwa kifupi sana. Karibu.
Good morning and thanks a lot for this summit. I'm sorry I came in a bit late. My name is Percy Wang. I'm from Ghana. I'm interested in 2 things. One is, what are the key lessons that you have learned in the pursuit of this national strategy? And what have been some of the challenges and how to address them? And I'm interested because, I think all countries can learn from each other.
Thank you, Percy.
Yes.
I'll just put it short because I can't pronounce the other name. Maybe I'll just ask Dr. to share with us the lessons that we've learned, and here we'll focus on the lens of the COVID-19 response, and now we are on EBD. And second, 2 questions on the challenges that we have encountered.
Thank you. I'll start with the lesson learned. My colleague can add. But with the COVID, as I highlighted before, in order to respond effectively, you need to prepare. And with the COVID, once the COVID was declared in Wuhan, in China, the country started preparedness activities immediately, and we did several preparedness activities. And once we had our first case, we were somehow prepared, and with the because the COVID was declared as a public health of international concern, we also involved the higher level. So immediately when we had our case, we had a very good support from across all levels of the government. So that is a very good lesson learned. But we had also, we managed also to identify cases immediately with our good surveillance system at across all levels. And the other good thing, we did our risk assessment immediately and identified like 8 high-risk regions and put more effort in those 8 regions. And fortunately, one of the identified high-risk region was reported the first case. So for challenges, coordination is still a challenge, resources, and it was another lesson learned that COVID facilitated development of various infrastructures like our laboratory. This laboratory was fast-tracked and started doing the testing during the COVID and got a lot of support from different corners. So disaster is an opportunity for better development.
Thank you. I would say one word these threats and disasters, they are there to stay. They are of various kinds. So the key for control is the preparedness, to have a well-prepared system, strong health system and resilience which can overcome and respond to any kind of threat which will come. Because they are there in series. We were in COVID, now before it ends we are now in Ebola threat. So the strong infrastructure, the strong healthcare system during peacetime is the key towards success. Thank you.
That was the key. When it comes to COVID, the same infrastructure was used, the same sample collection type and the same equipment on the resource. So it was easy to build from what we have there. And the challenge for the lab, the main challenge is getting the reagent, the proper reagent. This is very challenging, which we are on the lab side.
For me, what I learned on these particular vaccines or other countermeasures that are available to deal with the pandemic, but we in the developing countries, it was a challenge in some instances getting these countermeasures. So I would think probably we need to think how best we are going to address inequities for the countermeasures. So these developing countermeasures. So yes, you're looking at me. Probably we should do a final clap for the presenters, and then we'd like to announce this session is closed. But they are still here, they are in for this meeting. So if you have any questions or suggestions on what we think we as a country need to do on the areas of emerging and emerging diseases, don't hesitate to reach out to them. Thank you. So let us do a clap for them. Thank you very much for your time.
Thank you, MOH, for a nice forum. The coming session is for farm access. Farm access, you have 1 and 20 minutes for this forum. I would like to request you to spend your time accordingly and make sure that you finish on time. So we start the session from now up to 10:30. You are most welcome.
Professor.
Joining on that.
I don't share. I'm not going to share.
Oh,
Ask Sarah.
she told me to ask you.
No, it's different. I have a different name for
Good morning, everybody. Those who are tuning online, but also those who are here. On behalf of Farm Access, I would like to take this opportunity to invite you all, but also thank you so much for attending our Mom Care Symposium. And looking at you, looking at the faces, I can literally tell you are maternal activists. Please clap a hand for yourself. Clap for yourself, please. Are you aware? Tell your neighbor, be present. Tell your neighbor, be present. Now let this session everybody to be active. Tell your neighbor, be present. And if you don't mind, please fill front chairs, please. You're so scattered. Those who are personally reminds me way back in 2009 when I was standing in Kuruma Hall at the University of Dar es Salaam, contesting for vice president post. This was a post for a student union called Inaruso in Kuruma Hall at the University of Dar es Salaam. Actually, I was contesting trying to persuade the audience, just like you now. I'm trying to contest today, but I'm trying to persuade the audience to vote for me so that we can work together as a leader, but also in the sense of working together to create a change that we are looking for. Now it marks almost 12 years, and I'm standing in this Ruha Hall in the 9th Tanzania Health Summit, which has gathered in this one symposium intellectuals, experts from different walks of life, but also specifically from all experts from health sector, but also intellectuals and experts from different walks of life that are here to discuss an effective health financing models that will effectively, or that we believe we as Farm Access, as health stakeholders, will bring or will increase maternal health outcomes. So here we are at Farm Access to dialogue today, but also share our very beautiful evidence-based stories, but also our approaches that we thought are wise to conclude, but not to state that our beloved maternal, our mothers deserve more, but also we as key actors in the sector to look again on innovative, smarter financing models that at the end will increase or will improve our maternal health outcomes. Having said this little bit of introduction, may I welcome our beloved country director, Farm Access country director, Dr. Henry Mano. Please a round of applause for him when he's coming here. Please, Dr. Henry Mano, welcome please.
Good morning. Good morning. First I would like to thank all of you for attending this session. I understand that other equally important sessions are going in other different rooms, but I believe you are all here because you agree that mothers deserve more. Now, being a medical doctor, I came to know most of the medical conditions and diseases when I joined medical school in 1999, with the exception of one condition. that's maternal death. Which unfortunately I learned in a very hard way. Because that came a story when my aunt came to live with us. By that time I was in grade 4. I didn't know why she was pregnant. But later when I grown up, I learned that she came because we were close to the health facility. For those who know Sinza Palestina Hospital. So she came to our home and lived there for like 10 days. And one morning when we wake up, ready to go to school, my mother came back, of course, with other women crying. And when we asked, we were told that aunt, who she was, the wife of uncle, passed away. I asked my brother what happened. What he would tell me that she went to the river at the hospital and she passed away. Which I could not understand. Why would someone who is trying or is in the process of giving birth away finance maternal care in the country? Help us to reduce maternal death. So I wish a good session, enjoyable, but also interactive, so that at the end we all agree that this is a better way to finance maternal care, so that if we want to get the better results. Thank you very much, and you are also welcome.
Please be present. Tell your present, tell their friend, the neighbor to be present. Good that you are. Okay, thank you so much, Dr. Henry, for the opening remarks. And our mothers deserve more. And it's high time to think about smarter ways on how to finance maternal health care. With this opportunity, may I invite keynote speaker, Professor Kamarugo, former lead, health sector specialist from World Bank. Can you stand up, Professor?